Hi everyone, Ryan Rubino here. Today I'm going to talk about 4 key steps to managing your high-cost members and how you can improve the patient experience while also reducing costs. Let's dig in. Step number 1, know who they are. And that probably sounds pretty simple and straightforward, but clearly it's an important part of the process. And at Arcadia, we define high-cost members as those people having over $200,000 of spend in a given year, but clearly that criteria might be adjusted based on the specific needs of your organization. Step number 2, know what's driving the costs. And this requires some definition and organization. At Arcadia, we've established a framework to split out high-cost members across several categories, including high-cost maternity, high-cost admissions, high-cost drugs, high-cost rare conditions, common conditions, and an unclassified category. And when it comes to unclassified, you'd like that to be less than 5 to 10% and have all of these categories add up to 100%. Along with understanding what those high-level categories are, you also might want to stratify by payer, seeing that some contracts you might have might bear more risk than others, or perhaps there's certain trends and certain correlations to your high-cost membership and a particular payer. So both things that you might want to pay attention to. Step number 3, stratify for impactability and action. And what I mean by this is you need to understand what actions you can take to help improve the outcomes of these high-cost members. And some of these costs are more controllable than others. So for example, there could be certain cancer treatments that are underway and enrollment into a care management program is not going to make any difference. Whereas there might be other members that have a combination of conditions and social factors that indicate that they would be significantly helped by enrollment into a care management program. And Arcadia has taken this one step farther to build out a suite of machine learning driven impactability scores, which are basically risk scores that help identify who, if they're enrolled into a care management program, is most likely to have a positive impact. And there's other ways that you might want to stratify as well, such as by PCP or region, so that you can discuss the care management strategy with the providers that support these members. Lastly, step 4, automate your actions. With care management programs, there are a lot of repetitive, mundane, time-consuming tasks, and you want to make sure that patients don't slip through the cracks with manually supported processes. So you can auto-enroll, you can auto-task schedule, you could automate the care plan curation process, and this is another area where Arcadia has invested heavily to develop AI-based workflow tools to make this process more reliable and make these care management teams more efficient. To wrap this up, everything that I outlined in this video is part of Arcadia's out-of-the-box solution. So if you're looking to establish any of these capabilities, let me know if you'd like to take a look at what we have in place. And a key way that we help drive value to our customers is by accelerating the time to value, including a number of different things, including data integration, patient stratification, and AI-driven workflow automation. And really our goal is to make their entire team, including analysts and care team managers, be able to work at the top of their license and drive maximum value to the organization. If you made it this far, please hit the like button down below or let me know what you think in the comments. Thanks so much for listening and have a great day.